Hello everybody, thank you so much for joining me on yet another edition of the program You're in the Health and on Equinoxe Radio Multimedia. Cameroon has achieved a notable drop in HIV prevalence rate in 2024, with the current figure standing at 2.7%, down from 3.7% recorded in 2023. In today's edition of the program, we'll look at what HIV is all about and what must have contributed to the recent drop in HIV cases. But before introducing my guests, my co-host, Asa Lucy Lengo, is around. Hello, Lucy. It's a pleasure to have you on the program.
Hello, Immaculate. Always a pleasure. Good afternoon to our listeners and viewers out there.
Lucy, I give you the honor to introduce our guest tonight.
Of course, our guest is Dr. Glory BEFEKE ANYE. She is a general practitioner. Good afternoon, Doctor.
Good afternoon, Lucy.
It's a pleasure to have you on the program, Doctor.
Thank you so much, Immaculate.
Doctor, today we'll be looking at HIV, but before getting to, we celebrated World AIDS Day on the 1st of December, but before coming to what AIDS is all about, we'll start with the first. What exactly is HIV?
Right. HIV, its abbreviation means the human immunodeficiency virus. This is a virus that attacks the immune system, characterized by the CD4 cells or the T cells. These cells will normally help to fight off infections from the body, thereby preventing infections. But once this virus, the human immunodeficiency virus, HIV, gets into the body, it weakens the system and the system gets prone to infections.
How is this disease transmitted?
Transmission will depend on specific behaviors and some bodily fluids. You have unprotected sexual intercourse. We have through mother-child transmission. We have blood transfusion, but with blood transfusion, emphasis should be made that most of the blood that is transfused usually is well screened. So the transmission rate through blood transfusion usually is very rare. Through blood specimen, semen fluids such as semen, vaginal fluids, rectal fluids. So needles should be prevented from being shared to one another, because this is another portal of transmission through needles, syringes, especially in the hospital environment. And there are other means of transmission.
And before we continue, give out the numbers for those who like to join us on today's edition. We have 670-547049, 670-547049, or 656-622222, 656-622222 at the end. And back to you, Doctor. Let's talk about some of the symptoms which are common.
Some of the common symptoms, especially within the first month, let's say 2 to 4 weeks, once one contracts the virus, one will start expressing with signs or with symptoms such as the flu-like symptoms. We have fever, which are characterized by fever, chills, even night sweats. Sometimes we'll have rashes. We may have flat or raised rashes. Sometimes you see one complaining of sore throat, sometimes headache. Then with the progression of this virus over time, we may find one starts losing weight, maybe persistent diarrhea, pneumonia, and when it gets now to the disease phase, lymph nodes as well. When it gets to the disease phase, where we call it now the AIDS, we will now have manifestations such as those opportunistic diseases, TB, tuberculosis, even some cancers like the sarcoma, Kaposis, lymphomas. We equally may have some very deadly fungal infections like what we call pneumocystis and pneumonia. So we have some of these common symptoms that can be identified in people with HIV/AIDS.
But then we still have HIV patients who look healthy, who don't manifest some of the symptoms you just mentioned.
Right. The public health law has changed greatly, and which has really improved on the transmission rate of this infection. And we've even realized a drop in statistics of transmission, because people are becoming very aware of the fact that there is a disease such as this. And once they give themselves for that testing, and once they are tested positive, they are immediately put in under treatment. And for those who effectively take their treatment, the viral load gets reduced. Once the viral load gets reduced to an undetectable level, this transmission, you will hardly have it as maybe massive as it was formerly.
And if this condition is not treated early, how can it affect the body?
Right. If the HIV is not treated, it should be noted that the HIV virus can be treated. Treatment is different from cure. This doesn't mean it can be cured. The treatment means it can be put in a level where the virus becomes undetectable. Sometimes you see one on the antiretroviral therapy, goes to hospital, and if the rapid diagnostic test is conducted, some strips may read negative because they have attained that level of undetectable.
Okay, we'll come back to you, doctor. We have a caller on the line. Hello. Okay.
We lost that caller. So, doctor, she talked about treatment. Imagine someone who got infected of HIV, let's say 6 months ago, or let's say a year ago, and the person gets frustrated, doesn't want to take medications. What are some of the risks involved?
The risks involved is some of the risks. We have the evolution of this virus into AIDS.
Okay.
So people should understand that HIV virus can be treated. But once it is left, like the example you just mentioned, it can progress into the disease form, which is AIDS, which is acquired immunodeficiency syndrome. That's the disease form of HIV. So AIDS can be treated, which means getting this virus into a level where its load gets undetectable in the system. Its presence in the blood system or in the immune system no longer poses continuous destruction or continuous devastation to the system. But once this virus is not brought to that level, the destruction rate continues, it will lead to severe complications, which will progress to AIDS, where we may start having issues like weight loss. Easily gets contracts the opportunistic diseases like the tuberculosis. Then we may equally find things like those cancers that I earlier mentioned, the Kaposi sarcoma cancers, the lymph nodes just get swollen, the lymphomas, and even like the cough. Sometimes because the fungal type is one of the most deadliest type. It's called the pneumocystis pneumonia. So once one is detected, it is advised, the public health rule or the WHO rule, especially with option B plus for the mother-child, states that one should immediately be initiated into treatment, antiretroviral treatment. This is to help the one live long, help the one live normally, and equally helps the one to go away from some of these signs and symptoms. So you may see someone with the virus, but the one will not be presenting with any of the symptoms that we are outlining here, because the one is effectively and consistently taking care of him or herself by taking their medications regularly and carrying out their regular checks.
Looking at the symptoms you just mentioned, cancer and others, if I just see someone manifesting some of these symptoms, is it good? Can I just clearly say this person has HIV, or is there a need for this person to go and carry out diagnosis?
Right. We call them opportunistic because a healthy individual will not easily contract a tuberculosis. For instance, if there is tuberculosis in the air in this room where we are, and I'm infected, you are not infected, they have higher chances of contracting it. Now, tuberculosis is a disease that is out of HIV. It has nothing to do with HIV. But because my immune system may be weak, very weak, in a way that my CD4 cells, which are those cells, or my T cells, which are those cells that should help me fight any stranger, any infection that wants to come in, for the fact that they are already weak by this virus, then I get easily susceptible or exposed to contracting, for example, the TB in the air in this room, So not everyone, there are those diseases that are around, we cannot attach them to this virus. But this virus equally has its own manifestations of particular malaria. With malaria, you equally have fever, you have chills, headaches. Those are signs equally of malaria. Dermatomycosis, you have rashes, elevated rashes, flat rashes. So it's not to say that once you have these signs and symptoms, it means already you are HIV. No, infected, but the frequent checks in the hospital is necessary, especially for those who are sexually active, who are careless with their sexual life, or who are even married and you are not sure of the next person.
Okay. Now, we'll look at our focus of today, which is pregnant women. Latest statistics states that at least 1,500 women were tested positive with HIV in the year 2023. Looking at this aspect, is there a possibility for a pregnant woman who has been tested HIV positive to give birth to a healthy baby who is negative?
Very, very possible. Depending on the respect of certain factors. Now, once a pregnant woman is detected positive, the woman immediately is advised to start her antiretroviral treatment. This is to help not only herself but the unborn child, so that the mother-child transmission should be reduced, should not even be there. By taking this therapy will enable the viral load of the pregnant mother to come to that undetectable level, because what the treatment is all about is getting the load, the viral concentration, the quantity of the virus in the system to a zero level. Zero level does not mean this virus is absent. No, because once you relax with the antiretroviral therapy, it will again manifest. So once this pregnant woman already starts taking her medications effectively and gets the viral load to that undetectable level, it gives the chances for the child to be born negative.
And can a pregnant woman, or can a woman breastfeeding her baby, maybe she's HIV positive, is this going to be the same procedure like someone who is not?
We have a call on the line.
Hello.
Yes, madam.
Good afternoon. Your name and where you're calling from?
Yes, I'm Mr. Kimate Jerry, calling from the DLM.
Thank you. Your question. Your question, sir.
Yes, madam. I wish to ask if you can use an emergency test to know whether you have HIV or not, or it's not advisable.
Emergency test. Thank you.
Yeah, I'm sure he's talking about the rapid diagnostic test. Of course. And if you are not so sure, if maybe it reads negative and you are not so sure, is to approach the next nearby maybe hospital where maybe an ELISA test equally can be carried out.
Okay.
And we're talking about women breastfeeding their children, those who are HIV positive. Is it going to be the same procedure like someone who is not HIV positive?
Yes. So breastfeeding is another method or another means through which this virus can be transmitted. We're talking earlier on about the means of transmission. So breastfeeding is one of such means. This is not to condemn breastfeeding by HIV positive mothers. an HIV positive mother who again is very disciplined on her treatment and gets her viral load undetectable, in the breast milk, you will not find this virus. So it helps this mother to breastfeed the baby, and it helps the baby to stay negative. So it's the same method. Here we'll lay emphasis that this mother takes her medications effectively, and she should do exclusive breastfeedings, not just for her, but for all other mothers. The exclusive breastfeeding for 6 months, the option B plus, according to WHO. So when this mother does that, it helps the baby as well to be negative. The mother needs equally to feed properly. Vegetables, fruits, and drink and hydration. She should keep equally well hydrated in order to enable and to reduce this means of transmission, and also take care of her nipples, both nipples, because sometimes the mothers may have some cracks as a result of poor hygiene at that level, and the blood-to-blood contact may be there. So any HIV positive lactating mother should make sure she maintains all these healthy practices in order to reduce the transmission from mother to child. And at the hospital, usually there are prophylaxis that are given to these newborns when they come.
Okay. And now, hello, we have another caller on the line. We'll come back to you. We just lost the caller. And back to you, Doctor. We know that recently the Minister of Public Health, during his last outing, said that the prevalence of HIV cases in the country has dropped from 3.7% to 2.7%. What do you think must have accounted for this?
Lucy, if you see, many people are already really aware of the stigma. What I mean to say, the stigmatization is not there as before. You know, formerly to say HIV, come to hospital, you are tested, even to do the test,
you're scared.
Just the fact of that the doctor has said go and do HIV, you start panicking. You know, we experience in the hospital that environment, that atmosphere is no more the same. So we find people who willingly are coming.
We have a call on the line.
Hello.
Yes, it's Afro Joseph Acha. I'm calling from Bunaberi.
Okay, sir, your question.
What I wanted to say is just appreciate and thankful for this information. The information is really, really clear more. I love that. And I appreciate it. May God bless people for this information.
Amen. Thank you. A pleasure. Okay, Doctor, they're appreciating your services.
Okay, thank you so much.
Yeah, and we're talking about the outing of
prevalence,
the prevalence rate.
Right. So people come up to the hospitals now willingly and say they want to check, they want to do an HIV test. And equally, the government is doing quite a lot because there are seminars, there are free campaigns that are organized, and the population is getting more aware of this infection. And the option B plus, when I say option B plus, it means especially for the pregnant women, once you test, you should treat. That rule applies now basically to almost everyone. Unlike before, where once one was detected HIV positive, you were allowed to get into the disease form, which is the AIDS. But you start already manifesting all those other symptoms that we earlier mentioned before the one was put on treatment. I'm sure it was due to scarcity of the medication as well. Now it's no more the case. Once the HIV virus has been detected, the ELISA test has been conducted, and you are found positive, you are immediately put on medication, and that greatly has reduced this prevalence.
In few seconds, tell us, what can people do to stay safe? Few seconds.
Right. Abstinence for those who are married, fidelity for those who are careless with their sexual life, use protection, use of condoms. Pregnant women who are positive, make sure you carry out your regular effective checks and take your medications effectively.
Dr. Glory BEFEKE ANYE, thank you so much for your time. Thank you to Lucy for taking part in the program. And that's what put an end to today's edition of the program. You're in your health on Equinoxe Radio Multimedia. For presentation, I am Immaculate Fogwen. I received technical assistance from Jonathan Babula and Bertrand Bonzini. Have a wonderful day in the company of more interesting programs on Equinoxe Radio and, of course, television. Bye-bye from now.